Hi, can you hear me? Can Travis hear me in the back? All right, I got the thumbs up from Travis. All right, good morning, everybody. Hi, thank you, Jill, for the introduction. And I may move around a little bit. I warned Travis back there. He's the audio-visual guy. So bear with me, I like to move around, and I may even move in and out of the crowds a little bit. For those of you who have heard me speak before, I like to work very, what's the word? I'd like this to be very interactive. I know we have a timeline, but if questions come up, we can see how those go as far as time. I'm going to stay here. To answer some of your questions, and we'll have questions and answers at the end. Well, first of all, welcome. I always like to see who's in the audience. Can I get a raise of hands for those of you that are supportive friends and family members? Hey, yeah, round of applause. Thank you. That's wonderful. Wow, that's amazing. Can I see hands for those that have acromegaly? Okay. Round of applause, please. Did you notice that I asked about supportive family and friends first? I'm a licensed marriage and family therapist. I've been licensed in the state of California for about 20 years. And I was raised in my schooling to look at family systems, the system of an organization, a family, corporation, a basketball team, a culture, an ethnicity. I see everything in systems. And so the reason why I like to find out who's in this audience is because I want to know who are your supportive partners. And the key word is supportive, right?
I used to assume that everybody had supportive families, right?
And supportive friends. Pick your friends wisely. We can't always pick our families, right? But supportive is the key word, and so we're going to address what I'm going to start going into when you see these slides. I've created this presentation for not just the one that is the patient, the identified patient, but also family. And that's for the children as well, okay? So let's get started. All right. I'm also in Los Angeles, what's called a geriatric care manager. I work with families and supportive loved ones that need help working with the aging and older adult population where there is disease, whether it be rare diseases, neurological diseases like dementia and so forth, any kind of disability. All right, we're going to get started here. Travis, just go for it, right? The center button, right? Pardon me? How about the arrows? Since I was at the last conference, my eyes have changed. I've seen my aging process, and hopefully it's just the aging process. So if I go in and out of glasses, you'll understand. So why is this topic important? And you'll see on the slides here. You're not your diagnosis. So in my practice in Los Angeles, I work with a lot of clients, patients, family members, physicians who come to me and on many different levels are struggling wherever they are in the process, whether it's before a diagnosis, on the path of searching for a diagnosis, just recently been diagnosed, maybe something was found on a scan incidentally. I've had a couple clients come to me as a result of a car accident, find, different issues that are going on, whether it be a tumor or something on their pituitary, maybe acromegaly. And so it's important to identify that this is a diagnosis, this is something that's come along in life, this is something that wasn't planned, this is something that nobody saw coming, and so we want to move out of just identifying this as being who you are. It's a part of who you are. So what's important here about this topic is that we're going to look at the physiological and the psychosocial aspects of this disease and how to see how they're connected in life. We're going to do a lot of work this morning on how you cope. I'm fascinated personally about how us human beings cope in life, right? We've heard of maladaptive coping mechanisms. We know what those are. What's an example of a maladaptive coping mechanism? Drugs and alcohol, right? We know that one, right? How about compulsive shopping, right? To the point where you're carrying a lot of debt. We've all kind of done that maybe. And then there's many, and there's a support group out there for many. But we're gonna really be looking at how you cope, because you are gonna be, each and every one in this room copes differently. My coping mechanisms to help me get through grief and loss, which is a lot of what people face with this disease, is going to be different than yours. I got to focus back here. All right. So here are the goals. We're going to identify psychosocial stressors. These are going to be different from everybody, okay? Psychosocial stressors. Physiological stressors, social issues, understanding the definition of coping. And we're also going to go a little into a theoretical model that I like to use with clients. So take what you like, leave the rest, see what works and doesn't work, but we'll go into a theory called cognitive behavioral theory. Okay, psychological changes or challenges. Is there anybody in the audience right now that isn't sure where they are with the diagnosis? Has everyone had that stamped on their life? Anybody? Stamped. So everybody's here with acromegaly as far as your diagnosis is concerned, as far as what you have been told by a physician. Okay. No, anyone not sure? Yeah, I've got a hand up. That's not uncommon. It's a long path, right, to kind of uncovering for everybody in this room, for physicians as well, as they're kind of learning this disease. Unfortunately, you are oftentimes know more than the doctors. Anyone feel that before? Yeah, we're teaching them. And I have to, no disrespect to the physicians, as we all know, the medical schooling and training oftentimes with rare diseases is very little. So we're doing a lot of educating to them. However, there's been a huge amount of support towards educating physicians more about this, thanks to people like Jill, to the pharmaceutical companies that are reaching out more. So you're moving through life. Things are maybe changing in your body that you notice, or maybe that you don't notice. Maybe some healthcare professionals, maybe a dentist has noticed things changing, and so you're confronted with, what is this thing that I have that I can't pronounce? And right? For a lot of people. And what is it all about? So we want to look at that kind of that personal security that we're born into this world with. You know, like, who am I? What's my identity? You know, I'm healthy. All of a sudden, and how it affects us. And all of you have your different process of how you ended up getting to that doctor's office and figuring this out. What we also want to look at today are how this affects your relationships. For those supportive partners in the audience, again, emphasis on supportive, how has this affected your relationships in your marriage, as a mother, as a father, as a parent, as a sister and a brother? So I want you to think about a lot of those things today. So psychological challenges. You have a lot of choices. If you're confronting an illness or a surgery or a choice with medications, you need to kind of look at, how do I want to handle this, right? Post-surgery and then ongoing maintenance. There hasn't been a lot of choices, unfortunately, as far as what kinds of medications, how they're administered, injectables, as opposed to nothing yet approved for like a capsule. So we really are looking at, how do I want to deal with taking care of myself? And that's why this presentation is about your role in your coping with acromegaly, your choices, and how you're choosing to live your life. Okay, side effects of medications, lifestyle, those are important to look at. And kind of what's my view about all of it. Has anyone in the room had social challenges? How do I deal with this in my life today? Some hands in the back, a lot of hands. What's this mean? I don't want to go to the party. I don't want to go to that 10-year anniversary. I haven't seen people in a long time. So we want to start looking at, are we pulling away from our friends and family? Are we not showing up to things because of how we look or how we feel, energy level, fatigue, whether there's weight gain, side effects? So I want to ask yourself, have I changed? What's my part in my life today socially, in my relationships with others? Friends, family, turning down social events. This last question is something, as a therapist, I always am looking for when clients come into my office. Are you losing interest in things that used to give you pleasure? It's called anhedonia. It's a very important question in the mental health industry. Does anybody know why? Why do we ask that? Why do therapists want to know that? Depression. We're looking at, are we moving into a clinical major depressive disorder as opposed to being sad, right? Sadness is normal. Grief and loss is normal. I'm going along my life. I'm hit with this thing that I can't pronounce. It's somewhere in my head. I've got this tumor. I've got to have a tumor taken out. You're going up my nose, right? I mean, how scary. And so now you're kind of faced with, how does this all make sense to me? So grief and loss, which is a lot of what this is about, would you agree? Right? So we want to watch out for that moving into a clinical depression. So the best example of losing interest in things that used to give you pleasure is if you love, anybody love to garden? I can't keep anything alive. I wish I could. I have to buy the bonsai trees that like never die, or the bamboo, yeah. Okay, so those of you that like to have your hand in the dirt or smell your roses or plant your seeds or whatever you do, if you come into my office and have no interest anymore, and it's springtime, to smell your roses or plant your seeds or get your hand in the dirt, I'm worried. It's that. Anyone ever felt that before? Yeah? Okay. Depression's pretty normal. 1 in 5 women suffer from depression. I think it's 1 in 10 men. So, it's pretty rare for anybody to go through life without having a depression. We just don't want to live in depression. All right? Depression is all about being able to function or not. Life is pretty much about what gets you out of bed in the morning. Would you agree? If you can't function because you're so depressed, then we've got to get some help on board. Okay? So let's talk about coping. We're going to define what coping is. Coping strategies which refer to specific efforts, both behavioral, meaning the things that you do, how you act out your behaviors in life, and psychological, that people use to master, tolerate, reduce, or minimize stressful events, right? Life is full of stress, would you agree? Right? And so it's not about getting rid of stress. That's like getting rid of life. We don't want to do that. We want to be on this side of the grass, right? So life is full of stressors, whether it's your traffic or, your kids or balancing life or being hit with an illness. It's about how to cope with them. It's about how to master and really find a way to cope successfully for you, whatever that looks like. So I've come up with these 5 ideas, if you will, of types of coping mechanisms that I think are important. I look at these for myself, and these are some tools for you. This is about tools, things that you can take that may help in your life. So each of these coping mechanisms that we're going to talk about can be used in any given situation, and the goal is to become aware of which one works the best for you, or which one you tend to move into most in your life when you feel stressed. And we all go in and out of these coping mechanisms. So this is one of them. And I'm going to ask, for the purpose of understanding these coping mechanisms, try not to judge them. What I mean by judge is that, we judge everything in life. That's what we do. Try not to say this is a good one and this is a bad one, right? That's what we do by judging. These are what they are. The fighting spirit. I kind of think of Jill a lot in the fighting spirit. But I also know Jill's been in other coping mechanisms, which we'll look into, right? So we all want to be here. It's hard to stay here all the time, though. This is the one that person sees the illness as a challenge, has a positive attitude towards the outcome, has an active role in the life process, in the recovery, and can exert some kind of control over what they have. Maybe not over acromegaly, but maybe aspects of how you see the illness and what your part is. I have this, it doesn't have me. Okay, avoidance and denial. How many of you have already judged this as a bad coping mechanism? Okay, be careful here. Denial is very useful, okay? It can save your life. So we're not going to judge it for the purpose of this presentation. Why do I say that? Why do I say that avoidance or denial is maybe sometimes needed? Anybody have an idea on that? Gives you time to process? Yeah, it's a survival mechanism, actually. How about a severe loss, like a tragic accident in your life? Severe, not long-standing or long-growing, but just an acute crisis. Sometimes it takes people a while to kind of come to terms and realize what's happened. This is somebody who lives in denial or avoidance. denies the impact of the illness, kind of minimizes things. We do this in our interpersonal relationships, don't we? Denial. This can lead to the unhealthy consumptions in life. Drugs and alcohol, we all know, that's a lovely escape and a way to avoid what's really going on. And this can often lead to mood disorders, which we want to stay away from. So my symptoms will not go away, and it's not that serious. That headache that keeps coming, and I've lost some peripheral vision, but I don't really need to see a doctor. Okay? That's where we want to, those are the clients that I see, that I work on looking at that coping mechanism, trying not to judge it as a bad thing, but why are we living in it? How do we kind of move through this? Has anyone ever been in this kind of coping mechanism? I can't be the only one with my hand out. We're human. We move in and out of this all the time. We minimize things that aren't that bad. Okay, fatalism. This is a diagnosis where it presents as a relatively minor threat. There's no control. There's nothing I can do. We're kind of passive. We're not an active player in our life. We're just passive. It is what it is. It's all in the hands of fate. I don't need to do anything about it. This is a coping mechanism. Again, we're not going to judge it. Has anyone ever been in fatalism? Right, who cares? Doesn't matter. Just kind of let it be. So this is an interesting coping mechanism. And yes, so you may question, well, why would you say helplessness and hopelessness is a coping mechanism? How is that coping? Well, you'd be surprised where you can easily slip into helplessness and hopelessness. Feelings of being so overwhelmed and engulfed. Your focus may be on the loss of life and the impact of change in lifestyle. That no control. I can't do anything about my situation. There's nothing I can do. What's the point of going on? Anybody ever been here before? Very common. Not a bad thing. Not anything to be ashamed about or embarrassed about. But sometimes we can go here too. We just don't want to live in this. That's where it gets dangerous. And we have to really be careful of self-pity. That can go feeling sorry for ourselves. We can really slip into the hopelessness and helplessness. So this is actually my favorite coping mechanism. This is where personally I go a lot, that I always have to check in with myself. Anybody worry a lot in this room? Does anybody self-diagnose? I have this 19-year-old daughter. What is with these millennials? She calls, I've just been on WebMD. I have this, I have that. She self-diagnoses. I'm like, stop already. They all know what they, I mean, so we love education, and I don't know how we got anywhere without search engines or Google, I mean, all this stuff out there. Be very careful about spending a lot of time looking into every side effect on a medication or issues or whatever you can find out there, because it's out there and it's going to make your head spin. Anxious preoccupation, compulsive searching for reassurance. Much time is spent on worrying. Diseases coming back. What if this happens? It's all in the what ifs, and this coping mechanism is all about being way into the future and not being in the present moment. I can't cope with not knowing what the future holds. Anybody move into this coping mechanism? Yeah, some of you, yeah. And do you agree that you can be and move in and out of each of these different coping mechanisms, right? You're not always going to feel like I can conquer this thing. You may be feeling like in a fighting spirit, and then at the end of the day feel pretty hopeless, depending on the news or what's happened in the day. So what we want to look at is controllable versus uncontrollable stressors. So we all know there's a lot in life that we can't control, but we also know there's a lot in life that we can. And one of the things that's always emphasized at these conferences with Acromegaly community is that you have the power of choice. You can choose how to be an active player in your disease. You want to be able to, like Jill said, you want to hopefully be able to choose a doctor who's going to listen to you, who's going to be supportive, who's going to return your phone calls, and hopefully will know a little bit about this disease and be able to pronounce the word, right? Okay? So you want to be able to choose what doctor. Now, if you're from a small town, that's going to be tricky. But if you're not feeling good about the healthcare provider that's taking care of you, reach out to Jill like she offered. Reach out to somebody in this room. Do you need to go to another town? Maybe there's one closer with a better medical center. And then also you need to look at different treatment options. There's not a huge amount, but you need to kind of look at what's out there and connect here at this conference this weekend. Connect with people. Try to get out of your comfort zones if you're here with loved ones. Meet some other people from around the world. Listen to what they've done, who their doctor is, what treatments are they choosing, how are they living their life today, where are they stuck today. Work together here. So we want to kind of deal with how we can control some of these stressors. We want to utilize strategies, problem solving, right? Setting goals, being that active player. So how do you cope with life where we can't change things? You know, what do we do when we can't control the medical issues that are coming about? You know, so in the mental health industry today, with psychologists today, we work with our clients on mindfulness exercises, deep breathing exercises, visualization. We know today that sports figures, a lot of athletes, professionals, do a lot of visualizations so they can make a three-point shot. That's not easy. That's just not practice all the time. But they're doing a lot of work on themselves, spiritually, emotionally. Anybody heard of some of these kind of exercises? Okay, good. So I'm going to talk about cognitive behavioral theories. Anyone ever heard of that before? Has anyone ever been in a setting where you've learned it? Okay. Medical professionals, psychologists, we tend to like to use this theory with patients because it's very concrete and it can be easy to teach and kind of easy to kind of grasp for patients. Again, this is one theory that I think is important to look at and see if it connects to yourself at all. So the idea is there's a situation that we cannot change. Okay, that's the theory. There's a situation. All right, so over here it's a situation. The theory is that there's a relationship between your thoughts and how you feel, and then as a result, how you behave. And behavior, again, means the actions that you take in your life. Why you choose that particular job, or why you choose that particular reason for parenting, or a choice of a physician, things like that. But the situation doesn't change. So, for example, the situation is that there's this diagnosis, there's a medical issue. Life is going along, and you're hit with a medical issue. And so the thought that maybe comes into your mind is, I'll never be the same, Mrs. That's the thought, okay? We all know that there's a fact to having acromegaly, to having other rare disorders, having a neurological disorders. We're not going to change that fact, that you may need a surgical procedure, that you may need medications for the rest of your life. That's not going to change. I want you to look and think about, what are your thoughts about it? Everyone will have a different thought. I want you to see the relationship and connect your thought with how it makes you feel. That's the theory. That's the theory. So if I think that way, how is it going to make me feel? If I think my life is over, I will never get a date, I will never find a friend, I will never this, never that, never this, it's going to be pretty hard to feel good, don't you think? Do you see the connection? It's a theory about how our thoughts connect to our feelings. And then if I feel crummy, I don't want to go to the 10-year anniversary because I feel so ugly and so uncomfortable in my skin. I don't want to be there. And then what happens if we don't show up for life? We slip into, right, those coping mechanisms, those feelings of helplessness and hopelessness. We start withholding and withdrawing. We even withdraw in our marriages. This isn't for I'm not speaking to those of you single people in the room. I'm also speaking to those that have partnerships. You can also withdraw in your partnerships, right? So the idea is that a situation not need to change in order for us to feel a certain way. If I change my thinking, can I then also change how I perceive a situation? So does anybody know, has anyone ever heard of something called automatic thoughts? The thought just pops in your head, right? It just is there, right? It kind of like our thoughts wake up before we do, right? So somehow they're so well rehearsed. Maybe we learned them. So here's another theory, right? We come into this world, in my opinion, pretty pure, right? We know there's genetic DNA strains. We know there's hereditary stuff. We know that. But I think we come into this world pretty pure. I hope that's the case. But we learn a lot, right? As little kids, we're sponges. Not just from our parents, it can be the neighbor, and definitely it can be teachers, right? Those are very big, impactful presence in our worlds when we're little kids. So we learn these thoughts when we're little. So let's identify some automatic thoughts that you have in your head. So the doctor office calls. What's your immediate thought? Don't answer. Okay, okay. I'm going to test you guys now. What coping mechanism is that? Avoidance and denial. Denial is not just a river in Egypt. Okay, I like that. I'm not denying. I'm just not going to answer the phone. Anybody else? The doctor's office calls. Ooh, how can you, what? Get out. It's the billing office. Yes. What's wrong now? Oh, what did the labs say? No, yeah, I have the same automatic thought. But the reality is, and if we go back to this theory, do we know what is going on? All we know is that the doctors called. That's really all we know. But our immediate thought is that something's wrong. Why would the doctor call me, right? Unless you have a good relationship with your doctor. What's your emotional reaction? So if I think that way, how do you feel? If I think something's wrong, I feel anxious, fear, worry. So you see the connection, immediate thoughts to feelings. Behavior then is avoidance. There we go. Core beliefs. Core beliefs. The core belief, core. Think about your body, your core, go in your gut. The core beliefs are really what we think about ourselves. They're underlying assumptions. Sometimes they're based on a significant event, they're unconscious, and they impact us all the time. We all have these core beliefs. Here are the biggies. And this is for everybody in this room. This isn't just about acromegaly today. This is about everybody. We all go here. But why? Where did we get some of these core beliefs? I got some of them. I got some on the other one. We all have them. They tend to be negative, but we have them, and they immediately pop up. So the idea is we want to interrupt and disrupt those automatic thoughts. That's the hardest part of this, is how to do that. So I'm going to talk about rational versus irrational thinking. I'm not crazy about think positive. Don't tell me to think positive. I really don't want to think positive when I'm unhappy, right? And I kind of, positive is fine. There's 1,000 books on thinking positive. For me, I like the word rational. Rational versus irrational thinking. I'm kind of factual. I like things that are fact-based. So we're going to talk about rational versus irrational. Just because we believe something is true, does it mean it's a fact? No, and we all know that feelings are not facts. So let's talk about how do you tell the difference between a rational thought and an irrational thought. You're going to ask yourself 3 questions. Are my thoughts based on fact? We're not talking about feelings, we're talking about our thoughts. For example, the doctor's office calls. My thought is something's wrong. Now, are my thoughts based on fact? No, I don't know why the doctor's calling. It could be about billing, right? Maybe I left my cell phone at the doctor. What could it be? I left my number. Something's going on. They're calling me. Number 2. Does my thinking, the way I think, does it help how I feel? Is it helping me at all? Is it benefiting me? Does it help achieve my goals? And I don't mean it like the goal is some lofty goal. The goal is to get through the day sometimes. It's to get out of bed, right? So if you answer no to any of these 3 questions, you may want to entertain the idea of changing your thought. Really hard to do in the moment, especially if they're automatic. Do you want to keep the thought? You want to change the thought. Doctor's office is called. My thought is, it's bad news. I can change that thought to, I wonder why the doctor's calling. Maybe I left something when I was there yesterday. Can't find my glasses. Maybe that's why. Maybe I left my glasses at the doctor's office. Doctors called you to come into the office to update you on your prognosis. I know it's bad news. How do I know that? Do I know that? Do you know that? No. Ask yourself the 3 questions. I don't know what the news is. I've been down this road before, and I'm going to get through this because I have all of you in this room. I have this community. I have our website. I have a conference. I can call anybody. I will get through this. It's not going to feel good, but we'll figure it out. Change your thought. So how do we do this? How do we master this? Takes a lot of practice. It's like playing tennis. You pick up the racket, you got to get the ball over the net, right? over and over and over again. And so today is about just having you be conscious of your thoughts and how it applies to your life with having acromegaly. And maybe it does and maybe it doesn't, or maybe it moves in and out of your life. Maybe life goes along fine and then you're interviewing for a new job and you're worried what are they going to think when they see me, and are they going to worry about this or that? Well, you don't know yet. You just got to show up for that job interview. Oops. I like visualization. Anybody use visualization? Yeah, I think it's a powerful tool. I tend to be a very visual person. I like to be able to close my eyes and go anywhere in the world. And I think it's very important for those of you that either have used visualization as a tool or haven't. Find that place that you go that's healing for you, that's pleasurable. Can be a beach. People like to go to beaches. I actually go to a lake that I went to once when I was a kid, when I was hiking with my dad. And I go back to that lake all the time. And it really calms me. And things are always changing at the lake. That's what I like too about visualization. Don't judge it. Just let the seagulls move in and out wherever you go. Can I get some examples of visualization? Are there places people go in their minds that can reduce? Yeah. All right, you go to the beach with the ocean waves. You can see it, right? Yeah, you're right there. Yes.
I use visualizations very often. One thing is that I go to like a safari, with all the
She goes to a safari with animals.
animals.
Yeah,
The other thing is that,
I love that.
it's very interesting. Before I get the dance move, I visualize it.
Before you get a dance move, you visualize it. Fabulous. Then you can do it. I love that. I love the safari visualization because I would think like different animals kind of move in and out of that.
Yeah, usually far away, very far away from me, like in the prairie.
Sounds beautiful. Anybody else? Waterfalls? People love waterfalls. Yeah. Where do you go? Oh, I love that. You go to your house. Well, that should be so like your sanctuary, your home, your dogs. Wonderful. Wonderful. Well, visualization, yes.
We do sometimes when we're feeling sick or when something's dirty before we go to bed at night, we visualize little men or little substances in our body going to heal that area when we are really.
Oh, that's beautiful. Yeah, beautiful. So the idea of visualization, they were saying before they go to bed, is that your partner? So, husband? Right under the bus. I like that you do it together as a partnership. Get into bed together, even if you're feeling, a cold coming on, just visualizing, white light or little use your body to self-heal. Love that. Thank you for sharing that. So visualization is pretty, I think, fantastic. Mindfulness exercises. Anybody ever heard of mindfulness? It's become much more popular. I love mindfulness. I tend to be a fast thinker. It's hard for me to just totally meditate and stop all thoughts. Pretty rare. Anybody can do that? My hat's off to you. I like mindfulness because it's active. And I find that if I'm real pressured or stressed, I'm feeling like my body, my breathing, my speech is maybe pressured. If I'm feeling stressed about something, I will actually move into an action where if I'm walking in a hospital, I'll feel my feet underneath. I'll feel my feet on the carpet. I get very mindful in what I'm doing. And that tends to help me. Believe it or not, that's a mindfulness exercise. So looking at something and being very active in it, meaning your mind is stimulated. Anybody do mindfulness? Very good. So are you able to meditate where you can kind of really shut down your thoughts?
Yes, I have like 5 different meditation practice,
Wonderful.
and a few of them are just moving meditation, like a walking meditation,
Yeah.
standing meditation, prostration.
Wonderful. And she was talking about a moving meditation. So that would be something that I would like. So there are enormous amount of tools. There's apps today for meditation, mindfulness. There's tons of mindfulness exercises. Looking at a rose, touching the rose, peeling the petals, focusing on the color. There's a lot of, and you'll find that you'll move out of your thinking, your thoughts about what's maybe bothering you in the moment. So mindfulness, even if you tried it about a couple minutes every day or in the moment or in a situation, it can be very helpful. So, physical practice. While mental practice is very important, the physical practice even more is very important. So, for example, fears of doing something, public speaking, if you're not crazy about it, try it. Maybe join a Toastmasters, for example, that helps people pick topics and speak. It's kind of pushing the envelope a little bit. Getting out of your comfort zone a little bit, stretching, finding new ways of thinking and doing things. So if we're looking at changing thoughts, trying to at least, or being conscious of our automatic thoughts, you really want to be able to make the effort, try to change it, and repeat. Notice your negative thinking, if it's negative, if it's irrational. Challenge yourself with those 3 questions. Practice, we talked about. And then the action piece of it. We talk about being an active player in your disease process, in your relationships, with jobs, your coworkers, your children, your lovers. Who are the people in your life where you are an active player in that relationship, putting aside medical issues? How am I doing on time, everybody? Good? Okay. Cognitive distortions. Anybody ever heard that phrase? Cognitive means that thinking thing that we do again. Cognitive distortions. All or nothing thinking. Anybody go here? I see a partner arrowing, putting somebody under the bus again. That's good, that's good. All or nothing thinking. Boy, is this a common one. We know people like this, right? Maybe we are like this. It's very type A personalities are all or nothing thinking. If I can't do all the things I used to do, life is not worth living. Wow, that's extreme. Very dramatic. Right? Very all or nothing. All or nothing thinking. There's no gray. Catastrophizing. Are there any catastrophizing people in this audience? We're kind of back in our coping mechanisms too. We do this. We all do this. We blow things out of proportion. Now that I have this, my life is over. There's no evidence that your life is over. You know, life isn't fair, right? Not at all. Why do things happen to bad people? Good things to bad people. There's no evidence my life is over. I'm just going to have to adjust, adapt. I like adjust and adapt better than accept. But there's a place for acceptance. You just take some time to get there. It's really about how do I adapt to this new life. Shoulda, woulda, coulda. I should have done this. I could have done this. I would have done this. If I had only done that. Very dangerous. The shoulda, woulda, couldas. And we go into here a lot. Be careful of these. This is all about guilt. Okay? Yes?
I had a therapist once that had me take a piece of toilet paper and write, "I will not should on myself today," and put it up in the mirror.
I like that. Can I repeat that? She had a therapist that said, I'm going to have you say this. This is great.
Take a piece of toilet paper, write, "I will not should on myself today," and put it on the mirror.
Yep. The should and the would and the coulds. I should have done this if I had only done that. I'm facing a difficult time, and it's okay to ask others for help. As a society, we tend not to ask for help. Why is that? What does it mean to ask for help? We're weak, vulnerability, pride, embarrassment. But who said that? Like, where did we get that as a society? Like, where was that written somewhere? But you're right. You know, I can do it myself. I don't need your help. I don't want to be a burden. Well, we need help. We all need help. It's okay to ask for help. You know, putting aside gender, age, it's okay to ask for help. Yeah, I would like you to go to the doctors with me, honey. Yeah, I'm nervous. My labs came back. I'm nervous. I do need you to be there for me emotionally. What? Yeah, this woman was just saying you taught your teenage daughter that it's important to ask for help.
Well, just that people think it's a weakness, but it actually
It's
takes
a
more strength to admit that.
She's saying it takes more strength, she tells her daughter. It takes more strength to ask for help. Yeah, we have to be a strong person. So I should be able to handle this on my own. Whoops. I'm somewhere else. We're going to visualize. Now, this could be a very stressful moment for me. But I'm safe with you guys, and I can roll with things. Travis, I'm not sure if it's something I did. No, it's okay. Where were we? Shoulda, woulda, couldas. All or nothing thinking. Yes?
You were only trying to show us, to make it real for us.
There you go. That's right. That's right. Life doesn't go as planned. Thank you. Irrational should statements. All right, we did this one. If only, and I said that earlier, this leads to victimization. You don't want to be a victim. It's not attractive. It's not attractive to your partners. You don't want to move into self-pity. If I had only gone to the doctor earlier, if I had only done this or does that. So if onlys keep us in the past, right? The preoccupation, the anxious preoccupation keeps us in the future. Someone said to me once, and I love this, be where your feet are. Be where your feet are. You're right in the moment, in the present moment. And sometimes this is the hardest place to be, right? So be aware of if only. So it forces you to look at, so what do I need to do today? All right, stress. What do we do about it? Life is full of demands, adaptation, acceptance, adjustment. So, there is something about adding unneeded stress to our lives, right? And we all know how we can do that too. Unneeded pressure, stress on top of things. Oh, well, I can handle it, So there is something about kind of being gentle on yourself. People don't like that phrase either. It's like a little babying. But there is something about not adding too much to your plate, right? You don't have to go through life so pressured and stressed. You have to really look at that. And if you do have a condition that needs medical treatment or ongoing medication compliance, or you're in treatment for depression or anxiety, and don't forget about anxiety. People think you just go to therapy for depression. How about anxiety? Anxiety is alive and well, right? It's actually, therapists today, we call it an agitated depression. It's like you've got one coin and you got anxiety on one side of the coin and depression on the other. Very common today. So be aware of how you add stress to your life. All right, and we're going to talk about self-care, and this goes to the family members in the room. Self-care, everyone's going to take care of themselves differently. I'm going to do something different that you're going to do. So how do you take care of yourself? We know the basics, right? The basic activities of daily living. We eat, we brush our teeth, we get dressed, we go about. But what do you do to kind of self-care? And I'm not talking about expensive things and manicures and pedicures. I'm not talking about that. I'm talking about cost-effective, free stuff. Yes, Jill.
Up until this conference planning, I would exercise for an hour a day.
Okay, exercise for an hour a day. Fabulous. Up until the conference planning. And then what happened? That all went to pieces. When you're most stressed, she stops the exercise. The thing she needs. So we're going to see you at the gym later? God, that reminds me. Yes, go ahead, and then I'll share something.
Some of my me time is to just concentrate on me. I'll just tell my husband I'm going outside to just sit down. I know we have 1,000 things to do, but I'm just going to sit in the sun and enjoy the sun, and just have some vitamin D therapy. That's what I call it.
Did everyone hear that? Just asking for some alone time sometimes, especially from our partners, to just say, I need some me time. I need to go out and just be in the sun, get a little vitamin D, just to get, recharge a little bit. And that's also asking for help, Yeah.
Whoa. You know how we always tell kids that they need to go to timeout?
Yep.
Well, I discovered that it's better if we say, I need a timeout.
I love that.
And that way nobody's blamed if you're in the middle of an argument or anything else and they're wrong. You just say, I need a timeout.
And they're wrong, and I love that.
So
that's right.
then you go in your room, take a little wine maybe, whatever turns you on, and close the door and say, I'm so sorry that I need a timeout.
I love that.
And then
I'm
when
going to
you
use
come
that.
out, you don't care anymore about them. And it's really good with your grandkids. Okay.
And it's good with the grandkids. I like that. Saying, I need a timeout, honey. I'm taking a little timeout. Thank you. Rather than, you need a timeout. All right, good. I see some hands. Mary.
With what she just said, I love the timeout. Being a preschool teacher, we changed it to safe spot. So you can tell your grandkids you're going to your safe spot.
Oh, I like
to use your
that.
mindfulness.
That's a nice reframe because a timeout has a negative connotation, and we don't want kids, right? We want to say a safe spot. Love that. Okay. So self-care. Yes.
I forgot what
Forgot. It'll come back. It'll come back. Yeah.
I actually find that when I take care of other people, it helps me to realize that it's not about me too.
Thank you for mentioning that. The best way to get out of ourselves is by being of service to others, being of help to others, right? It gets us out of ourself, right? As a population, as a society, we're very self-focused, self-centered, focused on ourselves. That's a survival mechanism. But it's good to remember that, especially in conferences like this, like, I'm not the only one. You know, look around, you know, to get out of ourselves and be of help to others. I want to hear more about self-care. Any men in the audience? What do you do? Yeah.
So I have two things. One, much like Jill, I started today at the gym, and then second, about sleep and knowing that my body needs more sleep than I used to. So I have a sleep timer. So I go to bed, I make sure I get 8 to 9 hours of rest every night, and I'll feel more recharged and relaxed.
Thank you. So that's called having good sleep hygiene. Yes, that's what it's called, sleep hygiene. They actually, sleep experts today say that one should get up at the same time and go to bed at the same time. Actually make it a fixed routine. Do not be looking at the cell phone and all that stuff. So cool rooms, great, so sleep. And naps, rest. Right? Ask for when you need to rest. You know, your bodies are going through a lot. So make sure to rest and eat well. Jill?
I was going to say, I watch my diet.
You watch your diet. She watches what she puts in her mouth. She chooses what she eats, right? Nobody puts food in our mouth. We choose what we eat. So you watch your diet. Very healthy. Those are all good self-care. Yes?
I practice a meditation that's called the Bodhi meditation. Mm-hmm. It has, I just said, 5 different methods. So it's easier to get into a very deep meditation stage. I used to have like a very severe joint pain, like lower back pain, could not stand, walk, or sit for more than 2 minutes. And both of my knees has torn meniscus, and so I could not even sit in this chair without supporting myself. Or go to the bathroom is an issue too, and shoulder pain too. And now, with my intense meditation practice, or regular, or I'll say diligent meditation practice, I not only were able to sleep well. I used to have like a severe sleep, what is it called? Not the apnea, insomnia. Yeah, insomnia. But now I'm able to sleep very well, not only get more sleep, but also very efficiently. And then, so I wake up like very refreshed every day, and all of my joint pain went away.
Wonderful. Too. And I'm glad you mentioned, you brought up pain, which is something that often people feel, especially with acromegaly. Visualizations can be very helpful with pain. Thank you for bringing that up, meditation as well. Pain is exhausting on the body, and so you have to rest, you have to seek treatment for that, and medication as appropriate, and be aware of those medications that can be highly addictive too. So self-care, I wanted to just be mindful of how you either take care of yourself or need to take care of yourself more, and how you need to maybe reach out to your partners and say, I need to start doing this. And make it concrete. Make it part of your day, not just when a stress happens. Weave it into your day, like wake up and do the exercise. That's really important. Yes, Mary?
Oh, okay, so speaking in the sleep and not being able to sleep, whether insomnia, all those techniques are great. If they do not work, there's also something that I found. It's called alpha stem therapy. And it's a medical device. You can Google it, ALPHASTIM, because I've done the meditation. I've done a lot of the stuff, but then that also helps and definitely is the most important thing.
Yeah, thank you very much. There's huge studies that it's at the end of the day, it's really about sleep. You want to really shut down the mind and the body and get that sleep. If you're struggling with sleep, definitely to work with a physician about it. There are a lot of medications to help with sleep, and there are non-addictive medications to help with sleep. So if that's something that you need help with. I'll share something. When I come home at the end of the day, I need 15 minutes alone. And I actually do this thing where I have to physically get out of my clothes and put something else on. There's something about shifting out of the work that I do, taking care of patients all day long. I'm constantly giving and taking care of, so I need to come home and just change out of that uniform that I'm in as a way to really self-care. That's like one of the first things I do. Support groups. Raise your hand if you're in one, have been in one, are finding one. This is a huge support group right here. Yep. The best thing about support groups is that there's a common denominator. They're more powerful, in my opinion. I've been in support groups all my life. I'm in a 12-step program for over 30 years. And I love support groups because you can talk my story. You know, you've been in my shoes. And so for me today, I can bring you some pretty slides and some expertise, but I don't have acromegaly. I'm not in your body. I don't know what it's like. And that's something that physicians, we don't know, and healthcare providers. So it's really important. And if you're new here, if this is your first conference and you don't know anybody, that's okay. But I want you to reach out, at least come up and meet Jill or other supportive people or me to connect with, to meet some people here, so that when you go back home, if you're in a small town and there's nobody there, you've got somebody to phone. You've got somebody to call when you're in that hopelessness or helplessness or denial, or my doctor has no idea what's going on. We don't want you to leave here like that. We want you to leave here empowered. That's what acromegaly is about. Acro strong, and I love this, acro warrior. That's that fighting spirit. Okay, so really work, be that active player and reach out to those you don't know. And the husbands, partners, wives in the audience. You too, we don't forget about you, right? You're in a different role. You've married a partner, you're in love with this person, and this has come about. And how do you integrate this into your relationship, in your partnership? Because your role changes a little bit, right? A little bit. Would you agree if you're a supportive partner in here? If you have a loved one who's ill? Yeah, you definitely take on that caregiver role on some level, if not physically, emotionally. So reach out to other families. So, one of my favorite quotes. Watch your thoughts, they become your words. Watch your words, they become your actions. Watch your actions, they become your habits. Watch your habits, they become your character. Watch your character, it becomes your legacy. Your legacy is what you leave behind. It's your future. It's your children. It's your line. It's your bloodline. So it all starts with us. Yes?
With him telling me how he's feeling for the day, because he goes, full steam ahead a lot of times and doesn't complain and doesn't always let me know how he's feeling. But sometimes he'll turn around and he read a thing about the spoon theory. And he told me, look, I got one spoon left, I'm done. So that's a good thing for telling other people or telling me how he's doing, where he's at.
Thank you. Thank you. And I think the biggest thing is, in a partnership, is being able to share with your partner, and hopefully you have a relationship that's vulnerable and close enough to say, honey, I need this, or I need to take a break. I'm feeling something, and I'm just got to figure it out. Everything's okay. Not about you. It's my stuff. Thank you. Thank you. Yes. Absolutely. Can you see that? It's a great quote, isn't it? Yeah. Absolutely. Any questions? Anything pop into your head that you haven't thought about before? Did it move? What happened? Is that good? Travis. Yes.
What do you do when you're flooded? Like when everything, you face so many sudden stressors, issues, health issues, all at the same time, and you can't handle all of it at the same time. And what do you do in that situation?
I think you get on the phone. I think you reach out to somebody if you're that flooded. And I've been, we've all been there when your head's spinning and you're hurting, and whether it's emotional or physical. I think you ask for help. I think you try to get on the phone and call somebody. Yeah, within the group. If it's primary. Yeah. 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 You find the people that, yeah, I mean, boy, if it's 2 a.m. where you are, who's up at 2 a.m? Someone will be. Or if it's a time zone. Yeah, I think you find that those people that you can really turn to in those dark moments, those flooding moments. Yeah. You hope you can make the phone call. Because I think in those moments it's pretty hard, realistically, let's be real, everybody, it's pretty hard in those moments to start meditating, right? Or visualizing the pain to go away, right? You're really in the bottom of the barrel. So I think you reach out to somebody and just say, I'm really hurting and I need help. Yes, in the back.
I was listening to your feed through the internet, and I don't know if you covered this because I didn't hear it all, but I wonder if you have any thoughts on symptoms and signs of mental health for diagnosis purposes.
Symptoms and signs?
Yeah, so if there's something that is...
Yes.
That a physician should look at because they first came to see you.
Definitely. Thank you for bringing, are you a physician or?
No.
Thank you for bringing the up. We touched a little bit about it earlier about signs and symptoms, but boy, I could educate tons of physicians about signs and symptoms of mental health issues. So when we talk about mental health as a mental health clinician, I'm talking about really looking for mood disorders. I want to be aware of the signs and symptoms of depression or anxiety, right? And I'm always going to mention anxiety. Anxiety can prevent you from getting out of bed in the morning, right? It's not just depression. You can be so anxious. It can be just as debilitating as depression. Signs and symptoms. Number one that I'm always looking for. If you come to me and say, I don't feel good, I've lost interest in things which used to give me pleasure. Nobody says it like that. We say it like that. So if you're a gardener and you love your hands in the dirt, we talked about this earlier, but you then have no desire to look at your roses. Nothing. You are flatlined. We call it flat, right? That's a big sign and symptom that red flags should be going up, right? It's a very concrete sign and symptom too. That's why I like that one. I mean, sadness, okay, sadness is normal. Sadness is not a bad thing. We're sad. Life is full of sadness. So we want to watch out for the mood disorders, or I'm so anxious I can't breathe and I'm vomiting, right? Those are very concrete signs and symptoms. Tearfulness, am I crying at every little commercial? You know, are the tears right below the surface? When sleep is disrupted, so very common, just basic symptoms. Appetite. Appetite drops or increases. Loss of 10 pounds or increase of 10 pounds. Not medically based, mood based. I can't eat. Or I'm eating like a fiend in the middle of the night. Sleep. Is my sleep disruptive? Not, again, not medically based, psychologically based. Do I want to sleep all day long? It's a huge sign of depression. Or interrupted sleeping. I wake up and I can't fall back to sleep. appetite, sex, libido, sex drives drop when we're depressed or anxious. It's very common. Am I socially and occupationally withdrawing? Am I not showing up for light? So to answer those are your concrete signs and symptoms of mood disorders. Interesting. The question was, would I refer to a physician if they were speaking about medical, if they had some medical issues that they were worried about? You always want to rule out organicity. You always want to rule out, is there something brewing? If they're just coming, if it's more of a psychosocial stressor, like I'm going through a breakup after 8 years, I think that's more situational. I don't think I'd refer to an endocrinologist for that. However, if someone's coming in with pain and headaches or visual, absolutely. I'm a big believer in primary care docs. You have a primary care doc and then the specialist, the endocrinologist, cardiologist, pulmonologist, right? Everyone has, or neurologists, or yes. Yes.
I realized as you were talking about support that how often my husband supports me by understanding that I got to go lay down for a little bit. I need to just say that the reason I come here or I'm online is because I remembered in 2009 that when I was diagnosed, there wasn't anybody to connect with. You know, the internet was not really real. And those of you who are here today for the first time, can you just raise your hand if this is your first?
Is this your first time here? Look at you guys.
And the reason I bring that
so
up
glad you're here.
Is that my first time was several years ago in Chicago when we were there. And I went away feeling like I'm not alone and I'm not lurch. You know, there are other people who are going through what I'm going through. And I just think it's so important for us to support each other the way we are doing. And I just want to say to anybody who's here for the first time that it's now 2019 and I'm still here. I'm not healed, but I'm in remission, and you have a future. But more than that, on the journey, you have Jill and the other people that got this together today. Yeah. And I just want to thank them again because it takes such a tremendous effort to be ill like we are and still support one another.
Thank you very much. Yeah. And how wonderful to see those of you that just raised your hand. Welcome. You're in good company and you're safe here, and there's a lot of wonderful support. So I think the time is up. Thank you very much for having me, for allowing me to be here, to work with you. I'm staying here. I'm around all weekend. And thank you very much. Thank you, Jill.
So I wanted to wait until there were more people in the room before I also addressed. In the folders on the right-hand side, the front page is a photo video consent. We're live streaming. By the way. You know, for all the people that can't attend, you know, our group is worldwide and we're live streaming. If you don't want to be in any of the pictures and stuff, please try to avoid the cameras. But if you could please sign those photo release. It's not like we're going to post your picture all over the internet or anything. It's for this program. But yes. Okay, so Pituitary World News did our links, and they're also on YouTube. If you have our app, it's being live streamed to our app. So there's several different links, and Bella reposted it in our group just a little while ago. So. Correct, only the presentations are being streamed. No, not the party time. Also, I wanted to take a second to thank our sponsors out here. Years ago, we had to charge each person to attend this on top of travel. And if it weren't for the sponsors that we have, this wouldn't be happening. So please keep that in mind, that our sponsors really stepped up. I also want to do a special thanks to Miss Tessa Murdoch. I was drowning in work about 2 months ago, and I'm one of those people that it's really hard to accept help. And she contacted me for 2 weeks, almost every day, saying, "What can I do to help you?" And I know what it's like to live with this disease, and I don't want to ever put anything else on someone else's plate. But she was so persistent that I started giving her tasks, and a lot of days we worked 16-hour days together. And so I really want to acknowledge Miss Tessa, because she is my angel. And also, I want to acknowledge Bella. Bella, I don't know where she went. Miss Bella, she has been helping me with the wonderful app for those of you that have done it. She's also helped me redo the website. I mean, such help. We are only as strong as the people that support us. And I've been told over and over again what a special group we are as individuals, even compared to other disease states, that I think it's because of all that we go through. We're more empathetic, and we support people more than what most do. I also finally I want to also say thank you to Paul Mitchell. Have you guys noticed the Paul Mitchell people out there? For all of the conferences that I've hosted, I've had makeup people, and Paul Mitchell does both makeup and hair. And living with this condition, I'm sure a lot of the females, for men, it typically makes you just more manly. But that's not a good thing when you're a woman. And so, I really want to thank them for knowing that, inner beauty is what truly matters, but for making us feel beautiful also on the outside. So with that, Tessa has something really quickly that she'd like to say. Yeah, just really quick. Okay. Okay. Okay, and then I'll read what's. And is Dr. Regaris here? He's still. It's still 10 minutes out. If we just need to. So since the last conference, unfortunately, we've lost several members. And we wanted to do a little tribute to some of our members that we have lost since the last. Okay. You can, but I also want to point out, depression is a horrible thing that we deal with this condition. And, we've had people up there that couldn't handle this condition anymore. And even if you think that you can't handle even one more second of this, always try to remember that tomorrow can be better. Because on this, we've lost people due to that. and we've lost people to cancer, and we've lost people to adrenal issues. And these are all wonderful, wonderful people that I feel blessed to have known, and they should be here today. And you know, they're here, they're watching. I consider them my guardian angels. So Tessa wanted to read to you the.
So I just want. It was important to me that even though they are not here anymore, that we acknowledge them. And so after Sherry's passing, I thought we got to do something. So I reached out and asked her husband if he would be okay if we honored Sherry at this conference, because they were going to be here. And then we thought, let's do everybody that we have lost since the last conference. So in the middle, it says, God saw you getting tired when a cure was not to be. So he wrapped his arms around you and whispered, come to me. You didn't deserve what you went through, so he gave you needed rest. God took you home to prove to us he only takes the best. And then it says, rest easy, our friends, all our love, Acromegaly community. And then, most of you have seen my posts about my son, who is my world. So Mom and I arrived here. I opened up my luggage, and there was a note. Now, mind you, I had locked my luggage, and somehow he had found the key and went and unlocked it. And there's two notes, but on the top there was a Post-it note, and it said, he's 12, for TSA person. If you see the note under this note, it's for my mom. Please do not open it. Thank you, bless you. He was covering his bases. So then there's another note that he wrote to you all. So I'm going to try and read it without crying. Dear Mommy, I hope you had a good, smooth flight with Nonna. Nonna is grandma in Italian, and my mom's up here. Just please stay safe out there. It's a different state, and you don't know where you are. I love you safe. Love you to the moon 3 zillion times. Love, Parker. P.S. Hi, everybody. My name is Parker. I'm the son of this mighty warrior that stands in front of you. You are all warriors. God gave you these cards, and in my book, you've all played them well. God gave you this challenge for a reason, because he believed in you. You keep fighting, and you will prevail as a winner. May God be with you all. The end. And then he says, I love you, Mom. Farewell. PPS. That must be like for after a PS. Text me every day. So, and that's from my son, who, it's just been him and I. And he's rode this journey with me through 2 brain surgeries, a double bilateral mastectomy, and many more. He's fed me ice chips in ICU. He's helped me walk when I couldn't. And I'm constantly saying, sorry. I feel so bad, I'm so sorry. He says, don't say sorry, Mom. Because you're the strongest person I've ever met. He said, and in my eyes, you're already my hero.
So I promised him I would do that. And these guys. Thank you. So we're going to take a short break, and then Dr. Regaris is going to be back and do his presentation. He is the pain specialist and typically very, very popular speaker. So get your questions ready. He does do a pretty extensive question answering session after. So thank you.